Hello and welcome to Newsroom. We're coming to you live from Islamabad and I'm Sharmeen Ali. In a fresh round of ceasefire violations by the Indian military into Azad Kashmir, 6 more civilians were injured and among them were 3 children. And unfortunately, according to the media wing of the military, the ISPR, the Indian army attacked with heavy mortars, artillery and automatic weapons in Neza Pir. And this is a frequent occurrence that we've been seeing, particularly during the COVID-19 pandemic, as well as during Ramadan, when people are fasting and it's the holy month. We're seeing an increase in ceasefire violations and firing upon civilians. And also, along the same lines, Pakistan has also condemned the killing of a commander in Indian-occupied Jammu and Kashmir, Riaz Neku, who was the head of the Hizbul Mujahideen. And he was, according to Pakistani officials, he was killed in a search operation and cordon operation in his hideout. But according to the Pakistani Foreign Office, this was a fake encounter, which we see very frequently in Indian-occupied Kashmir, where people are arbitrarily detained and killed, and their remains are never seen again by their family, with no due course, with any sort of a justice system in place. Also, the WHO has issued fresh guidelines as countries are going to start easing their lockdowns, and these guidelines have been put in place to preserve workers, to protect workers and preserve gear for those workers who are at the front line, the medical workers who are in need of masks and gloves and personal protective equipment. The WHO has issued some new guidelines about that. We're going to be talking to our officials about that as well and how it's going to be implemented in Pakistan. So to begin with, the fresh round of Indian ceasefire violations where 3 children have been injured and several civilians have been injured in this case, amongst them women, girls predominantly, who are absolutely no part of any kind of fight or any kind of struggle with anyone. These are just innocent civilians going about their regular lives, and this is happening all the time. We have with us online now to talk about this Lieutenant General Naeem Khalid Lodi, who's the former Defence Minister. Thank you, sir, for being online with us today.
It's a pleasure. Thank you. Thank you.
So this fresh round of ceasefire violations where these 3 children have been injured and 6 civilians have been injured. Again, these are women, some of them are girls, they're children. They are not part of any fight. Why is it that the Indian Army continues to target these innocent civilians?
The first thing I would say is that we may call it a fresh round from the point of view of its intensity, that they have further raised the calibers and they've started using artillery very frequently, which was not the case earlier. But it is the continuity of, ceasefire violations which they are carrying out without any break for the last, I think, more than a year, and especially from the, earlier part of this year. So why are they doing it? I think their main aim is to crush the freedom movement inside Indian occupied Kashmir, and they want to keep us under pressure, they want to keep us subdued, or they want to keep the attention of the world, along this LOC, citing that we are just having a firefight, and equally both sides are firing at each other, where they fire at our civilians, and there are no civilians across. That is one thing. The other thing is that across the line of control, we have Kashmiri brothers and sisters, so we cannot target our own brothers and sisters. They are aware of Indian army, is aware of this fact. We only have to attack their bunkers, which are well protected. So that is the reason that for them the target is easier, for us the target is difficult. But still, we keep responding very effectively. Now we have to see. We have to look at the entire plan, what they are doing. As I said, that their actual plan in phase 1 is what they have to crush the movement, and then later on probably they will come for us also, and we can discuss that later. Yeah.
Right. Okay. So now this has become a sort of a norm. It's been happening over the past, it's been happening very frequently since August 5th, since the Indians they revoked Article 370 and 35A in Indian-occupied Kashmir, and they imposed a lockdown there. The intense firing across the line of control, ceasefire violations increased at that time. And now we're seeing them get even worse during the coronavirus pandemic, during Ramadan, at a time when more sense should be prevailing.
Actually, they are taking advantage of this pandemic because they know all the countries, including the superpowers and big powers, they are busy in doing things for themselves. They are all in trouble. So this they found a good opportunity and good time to carry on with their plans. One thing which we should be very well aware of is that whatever they've been saying, they have been doing it. Starting from their election campaign, once they said that they will change the status of Kashmir. They talked about the Citizenship Act, and they kept on doing it. They first, abrogated that 370 and other things, and now we know that they are trying to change the demographic situation by allowing other people outside Kashmir to settle over there and all that. So they are going according to plan. So once they are also saying that they will be attacking Azad Kashmir and Gilgit Baltistan, and because they claim that that is a part of their territory and all that. So we should. This is all very serious situation, and
Right.
the response, yeah, right,
Right. We also have online with us now Michael Kugelman. Sir, General Sab, stay with us, please. Michael Kugelman is the
right.
Deputy Director of the Asia Program. Thank you so much, Michael, for joining us online. I'd like to ask you about this. What do you see happening right now during the coronavirus pandemic with the ceasefire violations between India and Pakistan, the aggression that's sort of heightened at this time? What are your views on this?
Well, I think it highlights a really sad truth, and that is that the world has essentially come to a standstill. The world has essentially come to a halt because of the coronavirus pandemic. But one thing that has not been stopped, not one thing that has not come to a standstill, is conflict, tensions, rivalries, and I think that we're seeing that with what's been playing out on the line of control. We've been seeing it with the very unfortunate discriminatory measures being taken by the Indian government when it comes to providing care to those that need it for coronavirus. Quite frankly, there have been a number of accounts in Pakistan as well and elsewhere around the world. So, we've heard so many observers say, well, it would be nice if a serious threat that is shared by all of humanity would actually bring the world together for a change at a time when there are so many rivalries, so many disparities, so many troubling, divisive things happening in the world. But unfortunately, we've seen that simply is not the case. And indeed, on the LOC, there's been a lot of concerning things happening in recent days, and I don't necessarily think that it's going to wind down anytime soon.
Right. There's also a request by the UN Secretary General to tone down these conflicts, suspend them for 3 months so that humanitarian aid can get into conflict zones, including those like Kashmir and Afghanistan and places like Yemen. So also this is being discussed at the UN at the moment. What are the chances, do you think, that this might actually happen, that there could be a suspension of conflict zones for the next 3 months?
Well, I think it's unlikely. I know there have been some reports of some insurgent groups from around the world lowering or sort of reducing their fire. But, the ones that I follow the most, such as the Taliban in Afghanistan, and as you know, the offensives have actually intensified, though so have the offensives of Afghan security forces and U.S. airstrikes there. And I think that the problem is that these non-state actors, these insurgent groups, these militant organizations, they value the use of violence because it is such a powerful tool of leverage for them. That certainly is the case with the Taliban. And even something as serious as a deadly pandemic, one of the deadliest pandemics the world has seen in decades, doesn't appear to be enough to prompt these insurgent groups, these militant organizations, conflicting parties to rein in the violence for at least a brief period of time. And I think it really is quite unfortunate, to say the least.
Right. Stay with us, please, Michael. General Lodi, I'd like to now come to you and ask you about Pakistan has now been rebuffing the Indian claims that there are terror launch pads in Pakistan. They may go to the UN for this because these are very irresponsible statements and the claims that Pakistan has been infiltrating into India, etc. So what are your remarks on this, sir?
I think it's very simple to verify or otherwise, because as far as the UN observer group is concerned for Kashmir, we have that group on our side. And although the Indians, they don't allow that group to operate on their side. So it's simple and straight. Let that group come and observe along the line of control, and they can see for themselves. This is an old Indian allegation, and we are all aware of it. It's nothing new in it. If they are aware of any launching pads, then they should be attacking those launching pads. Why do they attack the civilians? I mean, why every second day we have one woman or one child or some civilian, they're getting injured and getting killed? And I think it is all fake. It is all the main thing which Kugelman was also saying, and I agree with him, that the world is too busy, mending their own affairs. And many, not only India, some other elements also, as he also mentioned, they are taking advantage of this environment, and they are just trying to further their own political interest through violence, which is one of the means. I would say that we should be very clear that in these times, Kashmiris and Pakistan, they have to fend for themselves. And you can raise your voice, you can attract the attention of other countries. I don't think they will be coming to your rescue. I don't think there can be anything which can resolve such issues, especially nowadays. So it is all up to you. How do you want to deal with it? And I would say that only operating within the circle of diplomatic norms and asking the world that why are you not responding, why are you not looking, is not enough. If you want to modify the attitude of India, attitude of Modi, either Kashmiris will have to do something themselves or Pakistan will have to do something. And nobody else is
Right.
going to our rescue. Nobody else is going to come for our help. Yes, we should keep on. We should keep on endeavoring as far as these diplomatic things are concerned. But there are other things. We must try some political things, new political things. We must try some legal avenues. We can even show some, our willingness to fight, so that the deterrence, that gets reestablished. So we have to think of other means also. Just by complaining and just by trying to attract the attention of the world will not work.
Right. Okay. And now coming back to you, Michael Kugelman. Now, we've seen that a prominent Kashmiri commander has just been killed, and at the same time, we saw that journalists previously were being detained over there. We've seen a lot of human rights violations in that valley since the lockdown in August 5th, and a lot of arbitrary detentions in the middle of the night. Sometimes children as young as the age of 9. Everybody in the world is aware of this, and like I said earlier, journalists being detained. Recently, 3 Kashmiri journalists from the Associated Press have even gotten a Pulitzer Prize for their work. Everyone has seen what's happening there. So, and we also saw that there has been concern at US SURF about this. We've heard a congressional hearing about it last year. Where do you think internationally and with the United States, this situation with human rights in India stands right now, Michael?
Well, first, I just underscore your point that what has been happening in Kashmir just over the last few weeks is quite unsettling, to say the least. And I think it really is terrific, though I know that many of my Indian friends would disagree, really terrific that you had 3 Indian journalists in Kashmir that received a Pulitzer Prize for photography the other day, which is terrific because it'll bring more exposure and prominence to these very harrowing images that they've captured there. Really post-August 5 in Kashmir. And of course, these are images that the Indian state would much prefer the world does not see. So that, I think, is very encouraging right there. And I also think it's striking that, as you noted, there have been several incidents in Kashmir in recent days where you had a militant commander that was killed. India has been saying that these are terrorists that have had to be destroyed. Now, the interesting thing is that one of the reasons why the Indian government justified its revocation of Article 370 is that it would, improve the security situation in a big way in Kashmir. And if that's the case, why are we having all these terrorists being found and apprehended? So I think that's a sort of an ironic point to be made in that context. In terms of, what the U.S.
One thing. Let me ask you, sorry to interrupt right now. The Indians call these terrorists, they call themselves freedom fighters, and the struggle for independence and self-determination is part of a fundamental human right under the United Nations. So how do you draw that line between a militant and a freedom fighter exactly? How do you define that, Michael?
Yeah, well, and I'm not going to try to relitigate an issue that's been litigated so often, but I think it really comes down to how you define the issue of a terrorist. And I think it also comes down to how you view India and its position. And so it's not a coincidence that those that support India and its view of terrorism, particularly the question of how it emanates from Pakistan, their terminology would be very much aligned with India and its claim that all of these folks are terrorists. Where, of course, those that would be more inclined to sympathize with the Kashmiri cause and, by extension, with Pakistan's position, would certainly see these folks as rebels, as freedom fighters, whatever you want to call them. And there's nothing new about this. I mean, this is the case with insurgent groups over time. One man's enemy is the other man's freedom fighter, whatever the term is. So I think it really comes down to positions and how you see the Kashmir dispute and crisis on the whole. I think that shapes the way in which you define and categorize these types of folks. But getting back to your question about what the U.S. view on all this, I've said it many times, including on this channel, I'm sure, that President Trump, he really does think about Kashmir. And in conversations I've had with people in the U.S. government, the view there is that he understands that it is a problem and that it is a significant problem, particularly in the context of India-Pakistan relations, which President Trump and the administration on the whole would much rather be smoother than they are right now, because the chief U.S. interest in South Asia is stability. But I think that the position of the U.S. government has not changed and will not change. That it does not want to get involved. It does not want to pitch itself as a mediator unless both sides ask it to. And of course, that's essentially an easy way out for the U.S., because we know that while Pakistan would very much like the U.S. to take on a bigger role, India does not want that, and it's not going to ask the United States or any external actor to get involved. So certainly, privately, I'm sure that there's a lot of concern among officials in the United States about what's happening in Kashmir. And indeed, you mentioned that USCIRF came out with its report that was very critical of religious freedom violations. But in terms of policy or shifts in policy or anything like that, I don't think anything's going to change. And going back to what your other guest, what the general had to say, I don't think that Kashmiris or Pakistanis can expect the world to try to focus more on this issue. I mean, that wasn't happening before the pandemic, and it's certainly not going to happen during the pandemic.
Right. Thank you, Michael Kugelman, for joining us. That was the Deputy Director of the Asia Program. General Saab, coming back to you now. Now we've also seen that the heavy-handedness of the Indian military right now in Indian-occupied Kashmir, the killing of Riaz Neku, the commander, also has been addressed by the Foreign Office, and the Foreign Office is completely just called it a fake encounter. And this is exactly what we've seen by so many other commanders, Burhan Wani and others in India. So your take on this? I mean, this has been going on for a really long time, and the Kashmiri youth seem to be pushed against the wall, and they seem to be sort of lashing back out at the Indian army. And this was a math teacher, Riaz Neku, who's turned into militancy.
True. As somebody said that if you try to solve a certain problem in the same manner again and again, when it doesn't get solved earlier, so it means that you are trying the wrong methods. So this, I think, we must get out of this complaining mode. We are only complaining to India, complaining to the world, complaining to ourselves, and whatever. We should understand that once 370 was abrogated, this disputed territory was actually converted into occupied territory. And the UN General Assembly resolution 3324, you can note this, 3324, very clearly stipulates that the occupied people have a right to fend for themselves, to fight for themselves, including taking up arms. And other countries are also allowed to help them in all possible ways where they can get rid of that occupation. So that is the situation. The thing is that we have a number of things that we can do in the political field, in the legal field, in the military field, and we are only doing everything and only in the diplomatic field. And I've said this thing umpteen time, that if you have 4 or 5 avenues and you are only exploiting one and it is not working, and you just keep on pressing in that direction, it will not work. It has not worked. I do not know what is in the mind of the leadership, the political and military leadership. They must be having something up their sleeve. But unless we see something, I don't know. They'll have to change their
So
manners,
let
I
me
would
ask you
say.
this at this
Uh,
point that last year when we saw when Balakot attacks took place and Pakistan responded appropriately and shot down the Indian fighter craft and their pilot was captured and then he was returned. At that time, we saw the tensions getting very high between the two countries. They are two nuclear armed countries. It's a nuclear hotspot right now. And at that time, we saw a lot of, again, belligerence from India's side, the journalists, the media. Meanwhile, on the Pakistan side, people were calling for peace. They did not want the situation to get out of hand. So that is everybody's main concern. There being two nuclear armed countries, how can they have a confrontation without averting such a nuclear conflict?
That is true. I mean, it is understandable and very clear that an open sort of conflict, an open war between two nuclear countries and that two neighbors where we have very short reaction time is a very dangerous proposition. But you would have also noticed that the moment situation escalated, the world came running to us when they were all advising us, one thing and the other thing. So that is the point. If one side is escalating and making offensive gestures, and other side is just waiting or just carrying out defensive gestures, so the world will not come because world is at ease. There's no problem as far as the world is concerned. But the moment you get offensive, also equally offensive, or even more offensive, then probably the world will come running. So we need to understand that whenever there's a nuclear or strategic balance, and one side is offensive, the other side is defensive, the world is at ease. But the moment the both sides become offensive, then the world gets attention. So we have to get world attention, one. And secondly, you cannot just have a one-way beating going on, and then you keep on complaining. I don't think this policy, I would not call it appeasement because we are defending, we are giving them a befitting response. But in my opinion, befitting response means that the next day the guns should be silent.
Right. Okay. Thank you for your input on this, General Naeem Khalid Lodi, who's a former defense minister. Now, moving on to the WHO issuing fresh guidelines while countries are easing their lockdowns. This is to protect the frontline healthcare workers and to preserve personal protective equipment for them. We have now online with us Qazi Ahmed Akbar, who is a spokesperson for. Sorry, we have with us Dr. Rana Jawad Asgar, who's an infectious disease expert. Thank you, Rana Saab, for joining us online.
My pleasure.
Right. So now the new guidelines that have come in from the WHO, can you just tell us how these now should be applied in Pakistan? Because we're seeing the number of cases are increasing in Pakistan and they're sort of reaching a peak, while at the same time the government has had to announce an ending of the lockdown and opening of shops. So these new guidelines, how will they work into this new scenario?
Yes. I think slowly the world is recognizing that, the interventions can't be applied uniformly across the globe. Every country has its own unique situation and the social metrics and economy. So every country needs to modify the intervention according to their needs. And I think that was the need which has been addressed by the new guidelines, which basically is trying to address intervention in low resource countries like Pakistan. And actually, it gives the prioritization of what we need to do and how we need to do in a phased way, understanding that social distancing may not be possible in major slums in our part of the world. So just insisting on having social distancing mean really nothing on the ground. So they come up with actually practical steps that, for example, if you are in that area where it's difficult to assume the social distancing in a Western style, you could identify one-way roads where people travel in one direction, so it's less chance of infecting by two-way traffic. Limit the going out or coming to the shops timing, or which group first need to go there, men, women, and so you can basically try and first understand the environment and then apply the modified intervention. So that's the one
Right.
thing. The second thing I think, which is very importantly came into those guidelines, is how to protect your medical staff. And we all need to understand that medical staff, and that's doctors, nurses, paramedical staff, or anyone who works in specialized settings in hospitals, is already in a short supply in all the developing countries. So, and if
Right.
that yes.
Right. Just at this point, I'd also like to invite Qazi Ahmed Akbar, who's a spokesperson of the Punjab government, who's with us online. Thank you, sir, for joining us.
Thank you, Shameen, for calling me here.
Qazi Sahab, I'd like to ask you at this point that these measures that the WHO has, the guidelines that they've issued, now that we're seeing in Pakistan, the lockdown is going to be gradually eased as of May 9th, shops will be reopened and all. How will we be implementing this and enforcing this across Pakistan and in Punjab?
Bismillah ar-Rahman ar-Rahim. You're very right, Shameen. Initially, the biggest challenge was to break the chain, and we went for a strict lockdown. And at that time, WHO was also advocating the same thing, that the countries need to go into the lockdown so that meanwhile they can prepare for the medically prepare for the upcoming emergencies due to this pandemic. Now the second phase was going into a smart lockdown. So Pakistan was preemptive about it. We went into a smart lockdown, and now from next week onwards, we are almost completely opening up. And it's not just Pakistan who's going to do this. There are many other countries, including Italy and Spain itself, which have been the most badly affected by the pandemic, and the America itself. They're all going to open up in the next 5 or 10 days. So WHO has given new SOPs in wake of this opening up. And I believe there's nothing new in those SOPs that have been given by the WHO. All these are already being followed in different countries. Pakistani government, the federal government, and the Punjab government have already made all the SOPs in this regard. We are very clear that how the industries are going to operate. We are very clear how the retail outlets are going to operate, how the small markets are going to operate, what will be the timings. And let me add something very important here, that all the decisions that have been taken in the NCC, they are national decisions. They have been taken, but that does not mean that they are the final decisions and they cannot be reversed. They can be reversed. One, if the pandemic again hits badly, we might go back into the lockdown. Number two, these SOPs, all these standards that we have put in place and the opening up, this can always be revised. So the government is open to all the options. This opening up has, Shameen, happened because of the analysis of the graph and the analysis of the pandemic worldwide and within Pakistan. Now, if the analysis and the graph starts depicting a different situation, I assure you that the government is all set to take a step back and revise the SOPs and revise the opening up and whatever comes related to it.
Right. Qazi sir, please stay with us online. Rana Jawad, now I'd like to ask you this. All over the world, we're seeing, as Qazi Ahmed was just saying, that the graph, the shape of the graph with the new cases and new deaths all over the world, including the United States, Europe, and even Pakistan, it seems to have topped out and is sort of declining again. So at this point, do you feel that if this lockdown is eased again and the country's opened up again, do you think that the healthcare system will be able to handle the new cases that might come up?
No, actually, I think this is not the correct. In Pakistan, we have not peaked the cases, and all the trajectories at this moment, our daily cases, as you could see it from the news, is going up. So in Pakistan, we are not sure because, number one, our testing was very small as compared to our population, and the testing is recently being increased. So once we have enhanced testing and have enhanced contact tracing, only then we can have a clear picture of our own trajectory and can make this judgment that where we are on this outbreak curve. With the current knowledge, no one in Pakistan can say either we have reached the peak or not the peak. That's the number one thing. Number two is that the countries which are easing up the lockdown are also putting a lot of emphasis on their contact tracing and testing. that area, even though it's being done in some part and somewhere, but it's still a lot need to be done in the both of those aspects. We have increased our testing, but it's still short, a long way short of what the required testing should be. I think once you add on these two things to make sure that we do not later be surprised by a sudden peak of cases in certain communities, the easing down of the lockdown is okay, but need to be complemented with very enhanced testing.
Right. Qazi Ahmed, now you heard what Rana Saab said just now, that the testing has been very limited and there's a fear that those number of cases are going to spike when the lockdown is lifted. So how is the Punjab government going to deal with that in case is the health system there ready for this?
Shameen, currently the situation on ground, we are all, not just Punjab, all the provinces are equipped to handle the situation. But let me just explain you something here. It's not just about the graphs. We have to observe and we have to analyze certain other parameters also. Just because, in Pakistan, every month there are 4,800 odd deaths in road traffic accidents. There are 4,000 deaths because of hepatitis C. In March, April, and May, these 3 months, we have 2,200 children per month dying because of diarrhea. So, if I compare these figures with what has been happening because of COVID-19, so we've not even closer to those figures. So, question ahead was that either we have to stay in the lockdown and not care for the people who have not been able to bring food to their tables. So the Prime Minister from the day one has been very sensitive about this, and he has been rhetorically saying again and again that we have to look after Corona and we have to look after our laborers also. So keeping that in view, the opening up has come up in phases. So yes, as far as the current scenario of COVID-19 is concerned, I also agree with Jawad Saab that the graphs are on a steeper side. We are, since the testing is increasing and we are also observing that there are more cases coming in, and now we are seeing that every day the number of people dying because of corona is also increasing. So yes, the situation is not on a flatter side or not on a positive side as far as COVID is concerned, corona is concerned. But opening up is another part of the thing that we have to keep in view, and which not only Pakistan is keeping in view, which is a very poor country, which has large fiscal deficits, which does not have the assets and the foreign exchanges to, foreign exchange reserves to fight this pandemic. Not only Pakistan is thinking of opening up, the countries with the highest dollar reserves are now started thinking and have started opening up. So it is something that we are trying to balance out between what the pandemic is saying and what the economic situation is saying.
Right. So, Dr. Rana Jawad Asgar, now coming back to you, what Qazi Saab was just saying about Pakistan being a country with limited resources, we're also seeing a lot of people with the potential of being driven into poverty and hunger. There's a lot of charity, of course, but at the same time, people getting access to all that charity may be a limitation. And then we're also finding that 1 in 4 families has reduced their food intake. We already have a malnutrition and stunting problem. All the other issues that we have, all the other diseases that Qazi Saab was mentioning right now, keeping those in mind, easing the lockdown and addressing all the other problems of poverty and hunger, etc., were necessary at this point, would you say?
I'm from the very start in favor of easing the lockdowns because of as the reasons you have already mentioned. The big chunk of our society is daily wage earner, and they cannot sustain for long lockdowns. But so easing of the lockdown is fine, but we need to, as I said earlier, complement it with other interventions, which is tracing, contact tracing, and testing. And making sure that if we see a spike somewhere else, we should be able to control it quickly. And for that, you need epidemiologists or other public health professionals who can looking for it. And so, just if they see a fire, they can control the fire quickly. So that's the major impact. But also, I will not, I don't buy this argument that if we have other diseases, it's okay to have COVID-19 also. COVID-19 is a new disease, and it's very, we are still learning about it. So where we should reduce our kids dying of diarrhea in this time and age, but that does not give us excuse to not to work on COVID-19. We need to work on all the war fronts and make sure that our population stays healthy and safe.
Right. Right. So, Qazi Ahmed Akbar, now I'd like to ask you, when the lockdown does ease on May 9th and shops reopen, how are you going to ensure now our country has a habit of coming out in large hordes into the marketplaces, and the concept of social distancing has still not fully registered. You're still seeing people come out in big crowds just when the samosa shops and all open for Ramadan. So how are you going to prevent them? How far is this going to be enforced, and do we have the capacity, our security forces, our police, to make sure that doesn't happen?
Well, Sharmeen, as the Prime Minister has said it a number of times, and I also strongly believe in that, because it totally depends on the Pakistani public itself. Now we have to show our own social responsibility, because when the SOPs were given for the masajid, in one of the TV shows, I was telling them that as per an estimate, there are 500,000 mosques in Pakistan. So if we depute one policeman on each and every mosque to ensure that the SOPs are being followed, that means we need 500,000 policemen only guarding the masajid at one point in time. What about the other law and order issues? So likewise, if we are opening up, people have to show the responsibility themselves. The government will try to implement the SOPs. The government will make sure that the SOPs are implemented. But until and unless we get a proper support and social responsibility by the public itself, I don't think so that these SOPs the government will be in a very good position to actually implement all these SOPs. So yes, the prime factor here is the public responsibility, the social responsibility shown by the public itself, and government is going to play its role as well.
Right. So, Dr. Rana Asgar, now, in your opinion, if the crowds cannot be contained, we don't have enough police to be at every mosque, as Qazi Ahmed was just saying, how is it likely then this pandemic could actually reach another peak and spread?
I agree with Qazi Saab, that government or forces cannot implement this SOPs everywhere, at every home, every shop. And here it's the duty of us as a citizen and also for media to have a very good campaign, especially focusing on these areas. And we as a citizen should be speaking up. For example, if we go to a shop and if there are more people, we should speak up and say, there should be, only maximum 3 people in this shop or 5 people, and let's keep that distance. So once we start speaking up, either it's a mosque or somewhere, and insist on this is let's follow, this is for our own safety. So these guidelines are for everyone's safety. So let's implement them and let's respect them. Once we as a nation don't become one voice on those SOPs, on those guidelines, and unfortunately we are not yet. People have different opinion on these guidelines, but we need to come together as a nation, as one on those guidelines. Only then
Thank you so much. Thank you for joining us, Dr. Rana Jawad Asgar. Online, he's an infectious disease expert, and we also have the representative of the Balochistan government at the moment. He's online with us. Liaquat Shawani. And Liaquat Saab, thank you so much for joining us online on our program Newsroom.
Ji, welcome ji.
Can you please tell us right now how prepared are the medical facilities in Balochistan? We know that is a largely sort of underserved province. We've seen that there are less facilities usually available there. Would you say that they're ready for the easing of the lockdown on May 9th?
Well, as you know, Balochistan is the poorest province of Pakistan, and particular the bad governance past burden is also upon the shoulders of Balochistan. So, in past, particular health department had not been the priority of previous governments. Since Jam Kamal Saab took charge as CM of Balochistan, he has been improving health department. We have established first ever cancer hospital in Balochistan, and many other BHUs and facilities and new hospitals being constructed in Balochistan. And in each and every tehsil, we are establishing dialysis machines and mobile laboratories and number of things. And if you are focusing particular on the current scenario of corona and corona-related facilities, so Balochistan government has established 71 isolation facilities across the Balochistan. 13 facilities are also only established in Quetta. We established 60 quarantine centers for 7,000 persons, where we can easily accommodate with all SOP 7,000 persons, and 1,700 persons can easily be accommodated in isolation facilities. And further, we are in Quetta establishing 2 more isolation facilities, where 2,000 bedded facilities will be established. In total, 4,000 bedded facilities will be established in Quetta. But when it comes to hospitals, particular ICUs and ventilators, this is the area which haunts us, and here we are very weak, and we have placed some orders in international market for ventilators, and also NDMA has committed us. They are committed that they are going to provide us 145 ventilators, but so far we haven't received anyone. So in this regard, ourselves and federal government, we are trying to establish further ICU facilities in any case of emergency.
Right. Thank you for joining us online, Liaquat Shahwal Sahab, and also Qazi Ahmed Akbar. That was the representative of the Balochistan government and a spokesperson from the Punjab government. We're getting first-hand take on the situation in those provinces and how they plan to combat the spread of the COVID-19 pandemic after the easing of the lockdown on May 9th. And now, finally, unfortunately, the renowned folk singer Kishan Lal Bhil died on Thursday at the age of 67. He's a folk singer who is very popular. He passed away in Cholistan, and this is a region where his art became synonymous with, and he has many fans all over the country. And according to his followers and his peers, his death is going to leave a huge void in the industry, because folk singers are very rare and they're very unique for Pakistan. They come from very particular areas, and over there they sing according to the culture of that particular region. So this was from Cholistan. And unfortunately, Pakistan has lost him today at the age of 67. That's renowned folk singer Kishan Lal Bhil, who's passed away yesterday at the age of 67. That's all the time we have for our program today. Thank you for watching Newsroom, and we will see you next time. Bye-bye for now.